Good morning. I'm Gordon Smith, the state's director of Opioid Response in Governor Mills' office. It's my pleasure to welcome you to our monthly Opioid Response webinar, where today we'll be featuring Mike Freysinger from the Office of Behavioral Health and myself talking about all things recovery. Richard Freund, who in charge of special projects at the Office of Behavioral Health, will be moderating, and I will be introducing Richard in just a minute. It's just only a little awkward because I'll introduce Richard, and then Richard will introduce Michael and I, and then we'll get on to the content. And we are so appreciative of all of you being with us. Many of you join us virtually every month. I want to remind you, for those that aren't familiar with it, that today is Black Balloon Day. That's a day we've recognized in Maine for over a decade now, to recognize people that we've lost from overdoses, and to also recognize the and celebrate recovery. And there will be it's always March 6th, and it's a somber day in that way. And tomorrow, I want to remind you all that there is an event that's expected to have several hundred people at the New Life Church in Biddeford, where there'll be a program recognizing Black Balloon Day from noon time to 6, and there'll be some speeches, but also some music and entertainment, and a lot of people there in recovery will be networking and supporting one another. And hope to see many of you there. So with that, I'll remind you that we do have programs already lined up for April 3rd, May 1st, June, and the governor's leading to the governor's summit, of course, in Bangor on July 16th. So with that, I'm going to turn it over to Richard for his opening remarks, and then I'll come on after Michael and talk about my segment of the recovery piece, which is really going to be on recovery-friendly workplaces. Mike will be talking about recovery coaches, recovery centers, recovery residences, all things recovery. I'll come in at the end, talk about recovery-friendly workplaces, and then we'll take your questions. So without further ado, Richard Freund.
Excellent. Thank you, Gordon. And welcome, everybody, today. So eager to have this robust conversation about recovery, one of my personally favorite topics. But again, Richard is my name, and I am a program manager at the SUD, Substance Use Disorder Programming of the Organization of Behavioral Health. Typically, I oversee a variety of special projects, some of them highlighted by the Options Program and the Options PR and the bunch of trainings that we do. We're offering ASAM training to people also affiliated with Treatment Connection and Open Beds. So there's a lot of projects out there that are reaching to people. And that's one of the great things about having Mike join us today is he represents the programming for so many of these recovery. We all intersect in the recovery field, whether it's the options liaisons or the recovery residences and the recovery centers and the peers and the recovery coaches. We have separate lanes, but they definitely intersect in some of the on ramps and the off ramps. But I enjoy this conversation as a person also, other than worker at the state, person in long-term recovery, happen to be a certified recovery coach and a coach revision person. So I love the topic from the inside, from the personal vantage point, and the business of it, which we do. We administer programs and we get to help people do the work that they do. And, like I said, Mike has been a great collaborator. We've worked on several projects together, and Mike leads the charge with the recovery coaches and the residences and the recovery centers, which we're going to talk about and learn more about what they do, what they offer, what value they bring. It's really a wonderful topic. So, Mike, do you want to take it from here and talk about the three big ones?
Yeah, thank you, Richard, and thank you, Gordon, for framing up today's conversation. Um, and when we met a couple of weeks ago to talk about how we sort of wanted to bring this information forward, and rather than creating a PowerPoint slide deck, I really wanted to be conversational, right? I took a peek at the participation list, and so folks that know me and folks that I've worked with sort of know that is my style, right? To be in dialogue, and so I think it's probably more important to like use this opportunity to share some of what is going on. And really, I'll ask Richard before we wrap today to put my email address into the chat so that folks can get in touch with me, so that we can really sort of continue that dialogue on an ongoing basis as we in the state of Maine continue to grow both the expanse and depth of recovery services in Maine. And so, as you heard both Gordon and Richard say, we're going to talk at first about recovery coaching, right? And that's the peer role deployed across Maine's system of care. I'll share more about the model, the role, and the growth here in Maine. We'll talk about recovery community centers, right, that really sort of serve as community anchors for these peer-to-peer recovery supports. Talk more about those centers and what they do. We'll talk about recovery residences, right? Peer-supported home-like living opportunities for individuals in recovery. We'll talk about the growth of that field here in Maine, which has just been absolutely extraordinary. And then we'll finish. I'll pass it back to Gordon, who will talk about the recovery-friendly workplace, where designated businesses support the communities by recognizing recovery from SUD as a strength and work to intentionally support folks in recovery, encourage healthy and safe workplace environments, and create positive change. And so we'll start with recovery coaching. And I just want to say too, right, that when we're talking about peer support and peer services here, we're really talking about that through the lens of SUD specifically. I know we sort of frame this as all things recovery, but in an hour, we're not going to get to all the things that the department supports in terms of recovery here in Maine. So really coming through that SUD lens. Recovery coaches are a non-clinical peer professional position who support individuals in initiating and sustaining recovery, right? The role is grounded in connection, trust, and empathy through shared experience. Recovery coaches focus on person-centered self-determination through strengths-based planning and removing barriers to recovery through goal setting and resource connection. The core principles of peer support are being recovery oriented, being person centered, being voluntary, being relationship focused, and trauma informed. Okay, and we're going to circle back to those core principles in just a minute, but I want to talk about sort of how Maine is connected to this work. And in Maine, recovery coaching is sort of a relatively new modality, right? With the first recovery coach training taking place in Maine roughly 10 years ago. It's sort of group of recovery advocates brought a provider into Maine to deliver the first training about 10 years ago. Since then, we have seen a strong commitment from the state and broad expansion of the recovery coach role. And now 10 years later, we see recovery coaches serving on options teams in recovery community centers as member of opiate health home and CCBHC multidisciplinary teams. We see recovery coaches in medication assisted treatment programs in some small private practices, and of course in emergency departments.
Mike, does the training CCAR related or exclusively?
I'm about to talk about the CCAR training, their model, and the variety of different trainings that they bring, right? But before I do, I just want to talk specifically about that recovery coaching and emergency department, because we haven't really shared very broadly yet. We just found out a few weeks ago that we received funding through the Rural Transformative Health Grant to expand that service. We're currently contracting with Maine Health to offer that service in 10 emergency departments across the state. And so we just found out we received additional funding and working to expand that service now.
That's wonderful.
And so, yes, Richard, it's almost as though you peeked at my notes. In Maine, we use the Connecticut Community for Addiction Recovery, or CCAR, training model. And the certification for recovery coaches is held by the Maine Recovery Coach Certification Board. The trainings here in Maine are delivered by two agencies funded by the Office of Behavioral Health, PRCC, or the Portland Recovery Community Center, and Healthy Acadia. Since OBH began funding those trainings, those two providers have combined to deliver more than 3,000 CCAR recovery coach trainings. I'm going to say that again. I think our first contract with those providers was in 2018, and since that time, they have combined to deliver more than 3,000 CCAR recovery coach trainings, right? Now, that doesn't mean that we have 3,000 recovery coaches, because those trainings, we'll talk about exactly what it means to become a registered and certified coach in just a moment. But those trainings include Recovery Coaching Basics, Recovery Coaching Academy, Ethical Considerations in Recovery Coaching, Spirituality in Recovery Coaching Professionalism, Recovery Coaching in Justice Settings, and Recovery Coaching with Young People and Recovery Coaching in EDs, right? And so thinking about the certification process for recovery coaches, right? Again, held by the Maine Recovery Coach Certification Board. And this is a question that I sort of answer all the time from providers and community members. What does it take to become a recovery coach? And so to become a registered recovery coach, folks must complete Recovery Coaching Academy and Ethical Considerations in Recovery Coaching. Take the proof of completion of those two trainings, bring them to the Maine Recovery Coach Certification Board website, upload proof of completion, enter some demographic information, and attest to ethics, and you become registered. And the sort of registered recovery coach designation is similar to what folks might know as like provisionally certified, right? Then to earn full certification, registered recovery coaches must complete and document and submit 500 hours of direct recovery coaching experience, and that can either be through a paid role or through a volunteering opportunity. 25 hours of supervision performed and documented by someone trained in coach revision, which is the unique recovery coach supervision model, and 16 hours of continuing ed opportunities in the 4 domains, which are advocacy, mentoring and education, recovery and wellness support, and ethical responsibility. And so again, huge expansion of recovery coach training, significant investment by our office to really facilitate that. And earlier, you heard me talk a little bit about the core principles of peer support. And I just want to spend a moment talking about how those core principles are furthered by the CCAR training and the values upheld by CCAR, right? And so recovery oriented, right? Peer support must be recovery oriented, right? And this suggests to us that progress is the goal, not perfection, right? This is where we see elements of harm reduction practices, avoidance of using a sort of illness framework. CCAR upholds these values with one of its principles, which is focus on recovery potential, not pathology, right? So strong alignment between those two core values. Another core value, and these are from SAMHSA, right? Another core value of peer support is that it's person-centered, which means that the individual seeking support gets to define what that support looks like, right? This is also the place where we recognize sort of really needing to focus on the person versus problem solving, helping, fixing, again, sort of something that's rooted in that illness modality and pathology. And this aligns closely with both the SAMHSA definition of recovery and the CCAR, a couple of different CCAR values, right? One of which is that you are in recovery when you say you are. Another is that there are many pathways to recovery. Another core value of peer support is that peer support is voluntary, right? Folks can't be mandated to participate in peer support. And this is another thing that I often discuss with providers. This is another sort of frequent request of the department to help sort of navigate this challenge. We sometimes see this in various settings throughout the system of care, right? Peer supporters don't have control over what treatment providers might sort of mandate, right? But as peer supporters, we shouldn't use that mandate to force people to connect in peer support, right? Within that relationship, everything needs to be a choice and negotiated between the two individuals. And again, this aligns with a CCAR value that states always err on the side of the recovery, right? And this one to me is really the most important of the core peer values, which is that it's really relationship focused. In order for peer supporters to practice with fidelity, they really have to have a solid level of self-awareness and self-reflection, right? Really have an understanding of like their own stuff that's coming up in these relationships, and consider what's happening for the other person in that relationship when we're bringing that stuff to them, right? And then, of course, trauma-informed is a core principle of peer support, right? And this is described by both CCAR and SAMHSA as moving from what is wrong with the person and asking what's happened to you. And I'm sorry, I can't help but see some of the comments as they pop up. And you know, if I can sort of share like one core principle from that brief overview of the recovery coaching role, it's that these roles aren't clinical, right? They really are based on the relationship and focused on the relationship. And based on that lived expertise of folks themselves in recovery. And in many ways, those same principles and recovery coaching are sort of at the core of what our recovery community centers do, right? Again, led by people themselves in recovery with that lived experience and lived expertise. Our recovery community centers really serve as community hubs for recovery services, right? They offer so much. I just want to name here that they offer so much. I hope that I don't miss any of the important aspects of what recovery centers offer here, right? But if I do, I'm sure I'll get some emails this afternoon. Recovery centers remain a significant priority for the department, right? Over the past 7 or 8 years, there have been a number of really positive bills in the legislature that supported the expansion of centers, funding for centers. They represent a key aspect of the opioid response strategic plan that I know Gordon will reference a little bit later. There are currently in the state of Maine 14 centers that receive funding from the department and another handful of centers operating with local and community support, right? Before I talk into sort of some of the programming that recovery community centers offer, I just want to share some numbers of deliverables that we have from recovery community centers. And this was in FY25. And so the period spanning July 1st, 2024 through June 30th, 2025. And so this is all of the recovery community centers across the state. Reported unique visitors, almost 12,000 unique visitors visited a recovery community center during that 1 year time. And when we look at duplicated visitors, over 77,000 total visits, right? And this is when I first started, we only used to collect that unique visitor reporting metric. And then I got this feedback from providers at centers that said, Mike, that reporting doesn't really do the best job of telling the full story of what recovery centers do. And to really flesh out the fact, and just in that reporting, right, we know that the average visitor actually returned on average about 7 times, right? And that really tells the story, and that's across the aggregate. That really tells the story of that sort of sense of connection, that sense of belonging, and what a good job our recovery community centers are doing in terms of building a sense of community, right, within their four walls. It's really great. One of the things that they do, and we'll talk a little bit more about this in just a moment, but is they offer lots of different groups and activities. And so in that same 1 year span, the recovery community centers, again, offered almost 12,000 groups or activities, attended by over 110,000 people, okay? Or had attendance of over 110,000, right? And then, of course, recovery coaching. Folks get lots of things at recovery community centers, groups, activities, informal peer support, and then formal peer support through recovery coaching. And during that same 1 year time span, the recovery centers had over 140 recovery coaches, either employed or serving in volunteer capacity, and delivered that to over 1,400 unique individuals. And so when we think about those sort of concrete program areas within recovery community centers, we've got groups, formal groups, right? Smart Recovery, AA, NA, all recovery pathways to recovery. Between our first meeting and today's webinar, I started looking over some of the calendars, and I really could not have brought forward an exhaustive list. There are so many and varied formal groups, and then to look at the informal groups and the activities that they offer, running groups, gardening, hiking, so much in the way of artistic expression, painting, writing, poetry, open mic nights, right? And I think one of the best things about both of these categories is that in most instances, many of these groups and activities are participant driven. And what that means is that a participant in a recovery center either sees a need for something in their center or has a particular passion for something and wants to bring that forward. And recovery centers staff will help them take that from an idea, help them sort of like develop it. How do you want to market it? How do you want to let your other participants know that this is going to be available, and turn it into a formal group? And if you walk in to any one of the centers across the state of Maine, you will see these participant-led activities taking place. And I only got through a couple of calendars, and most calendars you'll see 40, 50, 60 activities in groups a month, some well over 100. And I just think, again, that speaks to like the variety of services and programming offered at these centers, and knowing that most of those are participant driven and participant led, again, speaks to the way that recovery community centers sort of build community and ownership, and of course, service, which is really important in recovery work. And then I just want to, before I kick it back over to Gordon to talk about recovery-friendly workplace, I want to talk about recovery residences. Recovery residences are safe, healthy, family-like, substance-free living environments that support individuals in recovery. Recovery residences vary in structure, but are all centered on peer support and connection that promote long-term recovery. Recovery residences benefit individuals in recovery by reinforcing a substance-free lifestyle, providing direct connections to other peers, mutual support groups, and other recovery support services. The Office of Behavioral Health contracts with the Maine Association of Recovery Residences, or MAR, to provide several services, but primarily the certification of recovery residences in Maine using the national standard set by the National Alliance for Recovery Residences. Some of the other services that MAR provide are training and technical assistance for sort of prospective recovery residence operators and current operators, right? Developing policies, responding to challenges. MAR also hears grievances both by residents and community members. And they do a great job collecting data and supporting recovery residences to use the REBCAP data collection system. The Office of Behavioral Health also contracts with MAR to administer a housing recovery residence subsidy program called the Housing Subsidy Support Program, or HSSP. OBH allocates almost $1 million annually to the subsidy program. And I tried to pull some numbers. Where did I put them? Since the subsidy program began in 2023, it has supported more than 2,200 individuals, subsidizing more than 74,000 bed nights. We also recently launched a subsidy for young adults aged 18 to 24, and this just launched in October of 2025. And just in the first 2 months, supported 22 individuals, subsidizing almost 500 bed nights. Recovery residences have grown significantly just in the 5 years that I've been working with the Office of Behavioral Health. When I started, there were 35 MAR certified recovery residents. I think they ended 2020 with 42 MAR certified recovery residences. And I just pulled the most recent data. There are now 116 certified recovery residences, accounting for 1,530 beds. So just absolute significant growth over just the last 5 years. Question that I get frequently about recovery residents is the different types of levels, right? And so I just want to share in brief the different level types. So level 1, type P or peer run, these are really sort of democratically run alcohol and illicit substance-free homes, right? NAR even often uses the example of Oxford House, and so I'll share that as an example. Level 1 recovery residences simply maintain a recovery supportive culture and community using house guidelines and peer accountability, right? Then there's level 2, which they call type M or monitored. There are also alcohol and illicit substance-free recovery houses, use house rules, peer accountability. They typically have a house manager. They serve higher needs, population of folks that may have sort of lower recovery capital and need some support to sort of really develop that recovery capital, develop some life skills, but they're at a lower intensity for need and support than level 3. Level 3 is the type S or supervised, right? And this is where you are more likely to find those professionally super trained and credentialed individuals who really focus on the development of life skills, a higher level of structured support delivered in the level 3 recovery residence. And then finally, we have the level 4 or type C, and this is where we start to see an integration between the social model of recovery and some more traditional sort of clinical recovery services. And oh shoot, I forgot to mention that MAR also received funding through the Maine Recovery Council and is in the midst of executing the Rural Recovery Residence Expansion Program, which supports folks in the eligibility region is Aroostook, Franklin, Hancock, Lincoln, Oxford, Piscataqua, Saginaw, Waldo, and Washington counties. So northern and rural Maine, right? Which we have recognized is sort of underserved by recovery residences for some time. And so this is an opportunity to really promote the expansion of recovery residents in those communities. And folks could potentially receive support from MAR in terms of operator training and startup funding, support around certification, inspection, and ongoing support through MAR. I'm sorry, I forgot that. I skipped over that. And so I saw Gordon come off mute, and I don't know if he wants to pick it up here and share about recovery-friendly workplace before we open it up to questions.
Yeah, let's do that. And then we have a few points that we wanted to talk about, before we open it to the general Q&As. But yeah, Gordon, tell us about.
That's fine. And I think we could have done it either way. There's some great questions there that deserve a good discussion about, particularly the difference between the intentional peer support specialists on the mental health side and recovery coaching. I wanted to connect the dots too on one other thing. You've done a great job, Mike, of giving the overview of the different types of recovery residences. And the public, we think, does not have nearly enough information when they're seeking a residence for their loved one or for themselves. And I want to take it a step further from that and say the average person out there doesn't know the difference between medical withdrawal facilities, formerly detox, short-term residential, long-term residential, recovery residences. Which ones are treatment, which ones are primarily housing. And so in response to what's an obvious need out there, particularly as you've shown the extraordinary positive growth of recovery residences from 0 certified when I began 7 years ago to now 117. It's really important. And I think MAR has done a good job. Their website is great. They list all the homes and what's available there. But there's still a lot to be done just to distinguish recovery residences, which are not treatment until you get to level 4, and how those are distinguished from licensed treatment facilities. And so to go back to connecting the dots, there is a report about to come out from our overdose review panel. It's our 3rd public report, which looked at a cohort of cases of deaths, overdose deaths involving recovery residences. And the second topic in this particular report are some deaths of veterans. And that will be released within the next couple months. And one of the recommendations of our overdose review panel is that there be a more public education campaign around what services recovery residences do. Anyway, I'm going to move on to talk about recovery-friendly work sites, but we can take any questions about any of these things. We'll have a little time. I don't plan to talk about the work sites for more than 10 minutes. So I want to start with our strategic plan again. That was updated 2 years ago. It looks like this. Many of you have it. We gave it out in 2023. And it again is built around now 6 pillars, but I'm going to talk about again the usual most prominent pillars of prevention, treatment, harm reduction, recovery support. And this program today is focused on recovery support, and that is focus area 4 in the report. And like I say, there's now 6 pillars because in addition to those 4, we now include infrastructure and public safety. But this particular pillar on recovery has priority H, I, and has 6 different strategies in it, strategies 29 through 34. We're not even getting to all of them. Today, for instance, we could have a whole other webinar on recovery-friendly campuses and recovery-friendly communities. And that, of course, was featured a lot in last year's summit with Mark Lefever's book, which is all about how to create a recovery-friendly community. But today, I'm focusing on, again, the work sites, which are part of our strategy 27 and no, let me see. It's part of strategy 29. This story really begins with the work that New Hampshire did in 2019 when they took a federal Department of Labor grant and started what turned out to be a very robust program of recovery friendly workplaces. And they really have done a wonderful job in our sister state of also making their information available to many other states. And they've actually created now sort of an institute, which there's probably the majority of states probably now have some type of program like this to designate and certify recovery-friendly workplaces. The original intent, I would say, is built around, obviously supporting employees who may be affected by substance use disorder, either in themselves or in a family member. And while a lot of the interest is in working with human resources departments, and encouraging the hiring of people who may have a substance use disorder and who are now in the early or middle or advanced states of recovery, it also is designed to support the people in the existing workforce to send a message to them that as an employer, we are here for you. You need to leave at 4:00 once a month for a counseling appointment. Your only available AA meeting is at noontime someplace, and you need time to do that. We are here for you. So whether it's your existing employees or would-be employees, that's what this program is all about. New Hampshire, as I said, led the way. We wanted to do this way back in 2019. We finally got some money from the Prevention and Treatment Program to do a grant, and it started really around July of 2023. So we are about 2.5 years into that grant. I think Mike will confirm that because he's the program manager. And we have about 1.5 years left. Although it started out as 2 years, we're certainly going to be able to get 4 years out of it. I wish I could sit here and tell you that this program will be so successful. We've got so many employers in it, we'll be able to continue, and it will just grow on its own and continue. But we'll really have to work within state government, I think. My success was to make sure that we have some infrastructure and can continue this program beyond 2027. But we already have nearly 100 designated, certified, or at least companies that we are working with. And recently, the state of Maine signed on as an employer, over 11,000 employees, and that just about doubled the number of employees that we will be working with. So I want to give you the website because I can't tell you everything there is to know about this program, but if you go to RFW, stands for Recovery Friendly Workplace, Maine, rfwmaine.org, you will see there's a great many materials there, toolkits for your employer to how to ask for the designation, how to get the certification, what the training involves. And it really means that we have people who will come into the workplace, meet with HR people, and then do training of the employees, which is based upon 4 modules that are 1 hour each, that are in the process of being put on a system that can be viewed on demand. And The first module is basically a primer on what is substance use disorder. The second is about responding to overdoses. The third is about recovery, many of the themes we're talking about this morning. And the fourth one is about how to grow your recovery-friendly workplace. So I think that the contract holders are basically Pine Tree Institute down in Elliott and assisted by the Portland Recovery Community Center. It's important that you realize that the way that we put this together was really kind of grown organically from some local efforts. And the first one was really in Washington County. I want to thank the the Caring Community Collaborative and the Economic Development Council up there, the Sunrise County Economic Development Council. I don't probably have that name precisely right. And they worked with local employers in Washington County through a grant from the Maine Community Foundation. And I'm very appreciative of the Community Foundation for starting that work. And that was a pilot and a model for our statewide effort. There was also work that Jennifer Edwards did in Auburn, in the city of Auburn, to put together a similar initiative. And so now, as I say, we've got nearly 100 employers that have designated, and to get certified, you basically train your workers in those using those 4 modules. Even in the state of Maine, we will not be necessarily requiring a given office to train every single employee in that office. That will be up to the director and the people and the HR people in that particular office. Let me see what else I wanted to be sure to include. Well, I'm very appreciative again of Pine Tree Institute, the work that they've done working with PRCC. You should be able to walk into any of our recovery centers and get information on this program. I think the last thing I'd say is that in addition to really reaching out to helping people directly to be in the workforce and to support people in that workforce, I think undoubtedly this type of program, like our community center program, helps to break down stigma. We have so many people, including so many people that participate in these webinars, who are doing work every day to break down that stigma. But sometimes we spend too much time talking to ourselves, and it's hard to get to that next audience. I know you've probably heard, many of you are sick of hearing me talk, but I will repeat that when I go out to our forums, and I suspect that the Black Balloon Fest event tomorrow will be similar. I look out over this tremendous group of people who are working so hard and doing so much, but they're the same people. And if we're going to be really successful in this work and really breaking down some of that stigma, we need to be reaching the people who aren't going to come to one of our movie nights, who are not going to walk into one of our recovery centers. Whether we reach them by going to school events or other public events, going into the workplace, L.L. Beans, Bath Iron Works, the state of Maine. If we can go where people are and start having those community conversations there, that I think will be a really successful strategy in helping us break down stigma. So I hope that we'll be able to keep the program going. It's a pretty small grant. We give it $300,000 a year, which isn't enough to hire, a dozen business advisors, but we can have 2 or 3 people, helping with this work. And I'm very appreciative of the people who have been involved in it. And I'm going to turn it back to Richard to moderate some questions and answers. There have been some great questions in the chat, and maybe in the question and answer piece too. So thank you for your time, and back to you, Richard.
Thank you, Gordon, and thank you, Mike, for so many great areas to cover. So yes, we do have a lot of comments and questions. I know Clem's got one. When thinking of supporting individuals participating in treatment court, which level of recovery resident would best support these individuals?
I mean, I think that would be based on, their assessment, right? And, doing an assessment and getting that determination, sort of what's the ASAM level of care recommended by doing like a full clinical assessment. And then what other supports and assets do that person have in their life, right? Um, I don't think there is a sort of one size fits all response to that answer. We know that participants in treatment court come with different needs and different assets and different community-based supports and natural supports. And so really sort of evaluating that in its entirety to figure out if you've got, probably a level 2 or a level 3, but somebody with a lot of assets might do well in a level 1, right? And maybe they might start at a level 2 or level 3 and then step down to a level 1 as they succeed in the treatment court program, right? I know the treatment court in and of itself, that program brings a lot of wraparound supports. And they've got a lot of great folks on that team that sort of come to support that individual through a different lens. And so sort of using the collective experience from that group and the results of an assessment to determine the best type of housing support.
The other
Thanks,
point
Mike.
I would add, Mike, is that unfortunately, in a lot of locations in the state, we don't have all 4 levels of a recovery residence in that county. We don't have any recovery residences in Hancock County. We have 1 in Washington County. We have about 3 today in Aroostook County. So it's a great theoretical question, is that, boy, if I have a choice of 4, 1 in each level, which one would best fit me as a treatment court participant? Unfortunately, we're not there yet. So my feeling would be, well, any type of certified recovery residence would be better than not having something available for that treatment person. And we're about to have a treatment court in Aroostook County, begins in July, and we're very excited about that. But again, we need to grow the number of recovery residences in that particular county specifically.
Thanks, Gordon. Another good question, Mike. For someone just starting out as a recovery coach, what are the best certifications and/or qualifications to have to better assist you as a recovery coach in being employable?
Yeah, it's a great question. You certainly don't need any other professional certifications to become a recovery coach. You really don't. Lived experience and a passion for supporting folks in recovery. And you can take that, the Recovery Coaching Academy and ethical considerations in recovery coaching to become a registered recovery coach. If you've got some other experience, right? Maybe you were a leader in a type of a support program that helped you, right? Maybe you had been a sponsor before, but you really don't need any other certification to become a recovery coach.
Thank you. There's another comment in the chat, in the question and answer. It's fairly long, but basically it's talking about the ability for somebody in recovery to have a recurrence and have some difficulties, in that process, and who might run a facility. And the question really is, are there safeguards in place to prevent a peer support person from going down that road? And what are the safeguards to keep the issue from going on for any length of time?
Are they asking Richard about reoccurrence while a person's in a recovery residence, you think?
I think that it was an unfortunate situation in this area. We had someone jump through all the hurdles to get a drug treatment opened and only to open the facility and then devolve into reuse of the person running the facility. So I think it's more about the peer worker themselves in general than the specific case is, is there safeguards in place? And, we all have experience with that to some degree and who've been in that field. I don't know if there's a specific answer, but what do you think, Mike?
I mean, I would hope that any organization that employs a recovery coach is going to have safeguards in place to support their employees when they're having a tough time, right? I mean, that would be my hope for any organization, for any role at that organization, right? Whether it be a case manager, a clinician, or a recovery coach, right? And I didn't read that question. I know that they asked it specifically about sort of recovery coach and peer positions, but when I read a little bit more deeply into it, I didn't really sort of interpret that question as specific to recovery coaches. If a person cleared the hurdles to have a licensed treatment facility, that is sort of by definition clinical programming. Um, and so I don't know, maybe I'm misinterpreting that question because it seemed overt to like peer support, but then it went on to name that it was a treatment facility, which I read as clinical. Um, if that person has sort of more specifics they'd like to share, I shared my email address in the chat, and I'd be happy to sort of talk to them offline about that one. Yeah,
That's
right.
a good
Coach
idea.
revision, good supervision. A lot of agencies have employee support programs and really encourage their staff to sort of care for themselves, take time off when they need to, engage in wellness routines, all those sorts of things. And again, we'd hope
Basic self-care.
basic self-care. And again, we'd hope
Yeah.
that, really successful agencies are promoting those things for both their peer physicians and their clinically informed physicians.
Yeah,
I
exactly.
want, yeah, I want to distinguish between two situations. I mean, there is the unfortunate, and let's acknowledge first of all that recurrence is part of the illness, and so we should be kind and recognize that many people doing well today may have had some I don't know whether lapses is a correct term anymore, but you understand my point. I think we need to be kind. Number two, it really matters here whether you're dealing with an owner operator who's running a recovery center or whether we're talking about a resident. There are some safeguards now that allow a resident to be removed because we can't have active use, obviously, when we've got 6 or 7 other people in the home or 20 people in the home who are trying to be to get better. And what we're really missing in the state, and Dr. Springle and I and others have talked about this, is that when a person is removed, so they're removed from their housing, right, because of use, which is sometimes necessary to protect the other residents, we don't have a place for them to go. So sometimes these are called respite facilities, but you can imagine how difficult it is. I understand there's one such house in New England, okay? But imagine how difficult it is with me trying to message with the general population that, oh, well, this is going to be a house where people can go because they're actively using. You can imagine how that goes over. So it's sensitive, it's difficult, but I want to all know that we acknowledge that this is a gap and we will continue to be thinking about how we deal with it.
Thank you, Gordon. Mike and Gordon, one of the things you and we talked about was the idea of if I'm looking for a residence, how can I vet that location? What are the system to vet?
You go first, Mike.
Yeah, I mean, the first place to start is the MAR website, and they've got you want to make sure that they're MAR certified first and foremost. And then the MAR website has a residence finder tool. The top right hand corner of their website has this blue box, resident finder. And you can sort of narrow your search, different populations. I saw there's a question about whether or not it allows participants on MOUD, those types of things, right? And then most recovery residences have a website. And so reach out, ask some good questions. You can call the staff at MAR if you've got additional questions or if you want to know something really detailed about the residents. And then, ask within your community, call or visit a recovery community center, ask the staff, ask participants, those recovery residences that do a good job, develop really positive reputations, and folks will give those recommendations. And so I think the recovery community centers and talking to other folks in recovery is a really great place to lean.
Thanks, Mike. Gordon, did you want to add to that?
No, I go to the MAR website. I also would look for certified versus uncertified, but again, there are certified sites residences that you might find unacceptable, and there are uncertified sites that may be terrific. So you can't rest totally on that. And I think it's much like if you move to a new community and we're looking for a new doctor, talk to the people that have had experience with that doctor, with that facility. Visit, call our recovery center. There's 21 of them. Call recovery center and say, my son's about to come out of jail and it needs a place to, we need to get him into a recovery residence. Some people will refer to them as sober houses. Do you have any recommendations? What? So I think again, ask around, and it's the same way with our treatment facilities. Go to the treatment connection and ask about
Thank
people's
you.
experiences.
We have the last 1 minute question, Mike. What do you think is the most effective recovery initiative?
It's a great question.
You have 60 seconds.
That's a loaded question. The most effective recovery initiative, huh? Man,
that's like asking people to choose among our three children, right?
It really is.
It's easy for Mike because he's only got one child. But
I think rather than asking
what is,
I'm not going to answer your question, right? Because there is a theme that runs throughout all those recovery services that I think is really sort of the key to each success and the overarching success of recovery services in general. And that is that they tap into the lived experience and lived expertise of folks in recovery, right? It's peer support, right? It's that the department sort of recognized the value that folks with lived and living experience bring to the work and sort of like knew enough to say that's what we need, right? That is what will really sort of fill in some gaps in our system and help us better respond both through like some overt programming, but also integrating that lived and living experience and other components of the work that we're trying to support.
The essence of service, one helping the other. I love that. Well, I think we're coming up to the end. I really appreciate everybody's participation today, and I really was enjoying participants helping each other with answers and feeling that sense of community. That was amazing, and really, like we said, we could keep going on this for another hour at least or two. So it's a wonderful topic, and I always talk about the essence of recovery amongst those pillars to where it's the sustainable one. How do we keep this going? How do we facilitate that evolution and growth in people? And it's this one. So thank you, everybody, and it's been a wonderful discussion. And thank you to Mike, and as always to Gordon and Lorena. And we appreciate everybody's participation. And we'll see you April 3rd for the next webinar. And of course, again, the next one after that is May 1st. And ultimately the summit in July 16th in Bangor. Thank you, everybody.